There were 570,000 bankruptcies last year in this country. Of those 570,000, almost 70% of those were associated with medical debt. This is worse. 80% of that 70%, those people had health insurance. 320,000 people that filed for bankruptcy because of medical debt, and they had health insurance.
This is what it's like, funding evil.
You buy your health insurance and you think, oh, I'm protected. And then you present your first bill and it's denied.
Hi, we're here at America Fest. I'm here with Francis Curry of Altrua HealthShare. HealthShare.
But we do care.
Yeah. Okay. Awesome. And they're an alternative to the typical health insurance.
Traditional, conventional insurance.
Yeah. So you guys have a really unique spin, and I was talking about this about a year ago. Actually,
Really.
yeah, that we need to cut out, funding certain things through insurance.
Yes.
And it's like it's offloading the cost to everyone, and you guys are cutting that out.
Oh, yeah. Yeah, we're trying, Roy. And so as we were sitting there off camera, we were talking about a few things, right? And so we can always go to Obamacare and say about how it expanded things, right? It eliminated pre-existing conditions. It required everyone to accept healthcare insurance, right? It was a mandate that you have to get insurance.
Right.
But then the third thing that it did was if you couldn't afford it, it would give a stipend. So where does that go? So when you step into the health insurance world, right? And you look at the BUCAs, the Blue Crosses, the Uniteds that are going to pay for things that maybe as a Christian, you're not comfortable paying for. So they're going to pay for gender modifying surgeries. They're going to pay for abortions, things that we're not going to pay for. And as a Christian, if you're buying into those health plans, you're paying for some of those things, whether you know it or not. And so to your point, when it comes to an alternative, we feel like we are that alternative. We put God first. It's faith first. Second is family, not only our nuclear family, but family of Christians, family of people like this, right?
Yes.
And that we're sharing together. We're sharing because we have a common belief structure. We have a shared value system, and we have a statement of standards that we agree to that says we're going to live a healthy lifestyle. We're not going to engage in sex outside of marriage. Every life to us matters. It's a gift from God. So I'm not going to do any abortions or gender modified surgeries.
That's awesome. Yeah. Yeah. That's great. So you guys are not outsourcing evil. This is what it's like, funding evil. This is what I think a lot of the modern medical system does. It just allows people to run wild and do whatever they want, and the government and the whole society is going to flip the bill for it, which is it's disastrous.
It is a disaster. And so one thing I might caution is I'm going to separate the healthcare industry from the health insurance industry because they're two separate industries.
Yeah.
And the healthcare sector is your hospitals, your physicians, durable medical equipment, pharmaceuticals. They're promoting medicine, right? Then you have the health insurance industry. Came into being in the 40s when the government wasn't going to step up and actually provide healthcare coverage. So it created this industry, and it allows people now, to your point, the option of, well, should I go here because they cover something that I want, not need. Gender modification, I'm not going to say that's a needed thing, right? It's a wanted thing.
Yeah.
And then, so, but here's the other part, and I haven't said this yet today, and I think this is an important part too. So there were 570,000 bankruptcies last year in this country. Of those 570,000, almost 70% of those were associated with medical debt. This is worse. 80% of that 70%, those people had health insurance.
Wow.
So almost 400,000, 320,000 people that filed for bankruptcy because of medical debt, and they had health insurance. So here you go, you buy your health insurance and you think, oh, I'm protected. I'm so glad that I did this, right? And then you present your first bill and it's denied, right? So to your point, like evil, where do you want to go with that? we can shred that onion a lot of different ways, you know?
So I imagine you guys are based more on principles and that everyone is served in a way.
We try to. So we have a statement of standards and we have a series of guidelines. So the first thing that a member needs to do is agree that they're going to live a healthy lifestyle. And we give them some criteria to define what that is.
Sure.
Then so I'm going to use a scene from A Few Good Men, right? Where Jack Nicklaus is on that stand of, you want me on that wall, you need me on that wall. Well, when you submit a medical need, if you're one of the tens of thousands of members that we have, you want somebody that's looking at those needs to say, does that meet the criteria? Yes, we trust, right? So as a Christian organization, it's trust, but verify. And so we're the verification. So we sit in that role as an administrative agent to say, do these needs that are presented, do they fit with the criteria that's been presented? Now, to your point, there's going to be some things that don't. That happens, right? For whatever reason, whatever the criteria is, it didn't meet it. But we're a ministry first. So in our ministry umbrella, if a need doesn't meet what's being presented to the health share, it can be appealed. First of all, to say, hey, there were some extenuating circumstances. We really need you to reevaluate it because of these things. If it's still not accepted as a service that's going to be shared in, we can move it to the ministry side to say, hey, are there any monies over here? Like we've got Roy's got a need, it's presented. We can't cover it through the health share. It's not eligible for sharing. Can the ministry step into that void and provide some assistance?
Nice.
So we feel like we've got some layers there. Again, all from a Christian mindset, all from a Christian value system. But it's not just, to me, I've spent 35 years in this industry, so I've got a lot of different acronyms for things. And when I think of the BUCAs and a medical need is presented or a claim, I always view it like the Heisman pose. Oh, we don't cover that, or you're not eligible for that. And, it's all of how can we get out of paying for it? So we're going to increase the premium cost. We're going to increase your deductible. We all hear about the high deductible plans.
Sure.
All that is vocabulary to think of another way to kick the can down the road and keep the financial responsibility with the individual versus an organization that's sharing in those.
Nice, nice. And are you guys, I imagine you guys are saving a lot of money for the clients, for the people, or
Right. So we've been around 30 years. All right. We've tripped over $1 billion in savings. So now, granted, the industry helps us with that by their billing processes and practices.
Okay.
So they help us by establishing a pretty high bar in terms of, right?
Yeah.
So to save billions, you got to be careful and say, wow, that seems like a lot. Well, the industry is a trillion. So
yeah.
it's a big industry. But yes, we do. I mean, we do save real money. And we've got we have a situation. We have an individual that was unfortunate, needed a transplant. It was $1 million situation.
Wow.
So I mean, we're presented with those, and
Yeah.
you've got to, you got to run it through the criteria and see what happens. So we write some big checks.
Yeah.
But we're not doing it from a position of that's not it. That's not it. You didn't dot the I, you didn't cross the T. Everybody sees the statement of standards up front and they see the guidelines up front.
Yeah.
There's no hidden mystery in terms of what we're doing or how we're doing it.
Yeah.
We're just the administrative agents to make sure that, as you can imagine, when a medical need is presented, the medical industry works on a series of alphanumeric codes. I'm really going to bore you now. CPT codes and HICPUSH codes and ICD-10 codes. They go, oh, wow. So all these alphanumeric codes that basically translate to what was done.
Yeah.
And then what was done, does it fit with the guidelines?
Yeah.
If it does, that's an easy one. Push it on to reimbursement. I would tell you that of the majority of the medical needs that are presented, well over 80% are adjudicated and paid within 30 days.
That's awesome.
Yeah, it's really something. The ones that don't, they're a higher dollar value and they require a little bit more time,
Yeah.
maybe scrutiny, maybe validation that we have the right information.
Yeah.
Not judgment, information.
Yeah. And what do you think of like how the government is funding, these surgeries, they're funding abortion? I mean, you think it's something that can be changed at a national level? Like they should not be able to have the entire nation fund these things.
No, it's so then, I mean, really the first thought in my mind goes back to Roe versus Wade, right? I mean, so like you're really talking Supreme Court and our country is predicated on some of these decisions, right? And then we build policies off of that. I made a living, I made a career on the private equity side, watching the legislation for what was going to be reimbursed.
No.
And looking to the government to say, what are you going to pay for today? Building a business around it because they were setting the rules to the game. So to your point, can you change it? You can, but it's got to start at a grassroots level. You can't start at a national level and cram it down. We're too big of a country. We're too disparate in our belief systems.
Yeah.
There's not enough in the middle. It seems like there's more people going towards the edges, and they're so strong on those edges that it doesn't feel like there's a lot of collegial approach to finding a solution. But if you're an individual, if you're an employer group, we start at these grassroots levels. We look at self-funded types of programs, and we actually have an ability, Roy. We call it our MyShare program. And it really is a only pay for what you need type program. So you can build like, hey, you're a young individual. You may not want cancer share. You're young and healthy, so you may not want to buy into some of the coverages that would otherwise maybe be necessary or required if you were in an HMO or a PPO program from a generic national type program. So we allow an individual to define what they want. And as you're doing that, as you're moving this toggle bar across the type of financial range that you want to accept, it's pushing out the price point, the monthly contribution. So you're watching it in real time to say, okay, I'm young, I want to get married, I want to start a family, maybe I need maternity coverage. You can start moving some of the toggle switches to say, what does that look like from a financial participation? So really trying to gear it towards, I mean, really your age band. I mean, to be sincere.
That's great. Are there other companies doing similar stuff, or is that's not very standard? No, that's not standard. No, nobody's doing it.
No one's so to your point, yes, we do have competitors, and there's other health share organizations that have been out there, and they have their own things for what they're really good at,
Right.
right? So, as an industry, there's four of us that actually have an exemption letter from CMS.
Okay.
When Obamacare came in, they didn't want everybody jumping into this space, so they put some criteria out there to say, how are we going to vet organizations to make sure that they have the right infrastructure, they have the right financial resources, they have the right board and the right management team to be managing these buckets of money. We passed those tests, and so there's four organizations that have done that. There's more health shares that have come into the marketplace that don't. But I would say that we're a leader for a lot of reasons. Number one, we are, if not the oldest one, we're second oldest at 30 years. So we've been doing it for a while. I would say that with our team, we really are the ones that are changing the marketplace. So when I say the MyShare, yes, we're the only ones doing that right now. Most programs you're going to look at, and they're going to be like the HMO or PPO. They're going to have defined parameters for what you're buying into.
Yeah.
Ours is a little bit more focused on what do you want.
Yeah, exactly. And what's the most expensive one? Would it be cancer? Would that toggle?
It's
It's like,
it can be. Yeah. So for and cancer's built into a couple of our memberships.
Yeah.
So yeah, it's going to be several $100s a month for our most expensive.
Yeah.
But you look, so I've got a dear friend, and we've been in this industry a long time. We've been doing a lot of work together. He had a Blue Cross Blue Shield joint venture. He leaves that organization. He's looking for healthcare coverage. We're talking. He knows our founder. He says, Fran, you're not going to believe this. He goes, I am literally saving $25,000 to $30,000 a year because I'm with Altrua.
wow.
He goes, at the end of 4 years, I've got $100,000 sitting in my self-funded bucket. Something happens, I've got the financial reserve to deal with it. Or there's a lot you were mentioning Ozempic. I mean, there's a lot of these programs out there today that no one's paying for, right? But if you want to do a genetic profile, and if you want to get prescriptions compounded for something that's specific to you, no one's going to pay for it. But if you've got 25 to 30 grand on the sidelines every year to help you manage your healthcare the way that the freedom to manage healthcare the way you want for you,
Right.
you've got the funds now available to do that, which you're not going to get
From how much you've saved,
from
basically.
how much you've saved. Yes, I'm sorry.
That's smart. Yeah. Then you have freedom. You're not tied to.
I'm a choice.
Oh yeah, that's right. That's awesome. Well, that's awesome what you guys are doing. So
Appreciate it.
Yeah.
Look us up.
yeah,
All right.
thanks for coming out. How can they find you?
So altruahealthshare.org.
Okay.
ALTRUA. So altruism. So it's benefit for all. So altruahealthshare.org.
Amazing. You guys go check them out, and thanks for coming on.
Thank you, Roy. Appreciate you, brother.
What's up, brother?
All right.